Hello, my name is Kathleen Lisson. I am a board certified massage therapist and a lymphedema therapist, and I'd like to read to you from my book, which is over 120 years old. It's called A Treatise on Massage. And as you can see, this is the third edition from 1902. I'll read to you just in the beginning on the history of massage, and then I want to read to you the chapter on edema, so massage for edema, and understand that this is a book from the 1800s. This edition is in 1902, so this is well before the Vater style of manual lymphatic drainage. It's very interesting to see the far deep history of massage for edema. So first we'll do the definition and history of massage. Massage from the Greek, which translates to I knead or handle, the Arabic, which translates to press softly, the Sanskrit, which translates to strike, to press, to condense, is a term now generally accepted by Europeans and American physicians to signify a group of procedures which are best done with the hands, such as friction, kneading, manipulating, rolling, and percussion of the external tissues of the body in a variety of ways, either with a curative, palliative, or hygienic object in view. Its application should, in many instances, be combined with active, passive, assistive, or resistive movements, and these are often spoken of as the Swedish movement cure. So that's where Swedish massage comes to us. There is, however, an increasing tendency on the part of scientific men to have the word massage embrace all these varied forms of manual therapeutics for the reason that the word, quote, cure attached to any form of treatment whatsoever cannot always be applicable, inasmuch as there are many maladies that preclude the possibility of recovery and yet admit of amelioration. Hence, the word cure may lead people to expect too much. And on the other hand, the use of the word rubbing in place of massage tends to undervalue the application and benefit of the latter, for it is but natural to suppose that all kinds of rubbing are alike, differing only in the amount of force used. So I will say 120 years later, this is still a problem that some of us in the community are dealing with. People who think massage is just rubbing and it's just for the muscles, and that it has the only thing that we can change about our rubbing of the muscles is how hard or soft we are rubbing. So it's much more complex than that. I love looking at older books like this to understand that the knowledge that it was much more complex than that massage can be applied to many different conditions, comes to us from history. It's not something we've invented recently. The books that are over 120 years old understand the value of massage. So let's go to the chapter on edema. Again, this book is from 1902. The title is Muscular Rupture, Elephantiasis, and Edema. So we will talk about a case of elephantiasis. It was sent to me, the author states, by the late Dr. George H. Gay in November 1877. The patient, 69 years of age, presented the symptoms of elephantiasis but was otherwise well. The history of his trouble began 4 months before he came to me by him being seized with a sudden and severe pain in the middle of the lower part of his back, accompanied by chills while he was at the water closet in undress, having gone there soon after being circumcised. He could not go back to bed without assistance. In the course of an hour, the pain extended to the left hip and down the left leg, and soon the leg became swollen. For 3 months and a half afterwards, there was a loss of power and defecation, but the bladder was normal. When I first saw him, the leg from the toes to the knee was of a dusky bilious color, looked like a side of bacon, and felt almost as hard as a board, so that it was with difficulty finger pressure would leave an indentation. So we see that there's a change in the color of the leg and that there's pitting edema, but it took a while for them to do the pitting edema test. The skin, superficial fascia, and connective tissue were hypertrophied and indurated. So they hypertrophy and induration with here and there on the surface patches of eczema. So we already have the skin changes. It sounds to me like stage 3 lymphedema. To the patient, the leg felt numb, as might have been expected from so much pressure upon sensitive nerves. He could walk a short distance naturally. The calf at its greatest circumference was 2¾ inches larger than the other. Daily at first and every other day afterwards, I used showering alternately with hot and cold water, and this was followed by a deep, firm upward kneading, which was begun at the uppermost part of the infiltration and gradually proceeded downward. And the decrease in circumference obtained in this manner was held and continued by 2 or 3 layers of tightly applied bandages and instruction to keep the limb elevated. So this may be, to my reading, the first case of complex decongestive therapy that I've actually ever seen in the English language. In 4 days, the calf had decreased 1 3/8 inches in circumference. The leg was supple and more comfortable. The capillary circulation was better, and the patient could walk easier. At the end of 22 days, there was very little of the bacon board-like condition left, and the massage made greater impression, 20 minutes of it causing a temporary decrease of 1/4 of an inch in circumference, whereas at first, but 1/8 of an inch was gained. So they're getting a bigger increase in the decrease in swelling as they're doing more massage over the period of time. And the total diminution was 2 9/16 inches, only 3/16 of an inch more than the other calf after this course of complex decongestive therapy. The patient had 20 sittings in 5 weeks, at the end of which the calf was the same size as the well one. The skin could be pinched up in natural folds, but the ankle was still somewhat larger and harder than the other. He was then discharged with an elastic stocking and advised to continue the showering and keep the limb elevated as much as possible. A month later, his exercise consisted in a daily 3-mile walk, and that without discomfort. 6 months later, he had laid aside that elastic stocking and the leg continued well. That is so fantastic. I love that we heard a case that looked like an advanced case of lymphedema. There may be something also like a phlebo lymphedema there, and that we saw these components being used, the massage, the wrapping, and we saw the success of the combination of the two. The day on which I finished treatment of the above case, I found in Schmidt's, I'm going to massacre this German, Jahrbucher, a brief account of 2 cases of elephantiasis. So this text is from 1877. A brief account of 2 cases of elephantiasis treated by manipulation and bandages by Professor von Mosengeil of Bonn. In one, both legs were affected from the toes to the knees. At first, massage alone was used with considerable improvement. Then firm compression by means of roller bandages was added. After 5 or 6 weeks, the patient could walk better and the skin was thinner and more movable. The other case was less severely affected and greater improvement resulted. This is fantastic. It's pages 309 to 311 of A Treatise on Massage.